Preliminary data shows that the pandemic has amplified substance use disorder, with reports of over 80,000 overdose deaths in the United States in the past year, the highest number of deaths ever recorded. Experts at the CDC suspect that the intensification could be due to a disruption of daily life and increased stress. So as attention on COVID-19 wanes, lawmakers have begun to look again at the opioid epidemic. One of the bills up for discussion in the United States Congress is the No Pain Act, which stands for Non-Opioids Prevent Addiction in the Nation. The bill aims to encourage insurance companies to expand options for pain relief by targeting Medicare. If this bill is passed, Medicare patients would have more access to non-opioid choices.
The problem is there's not a lot of research about these types of treatments and their long-term positive effects. And so the biggest obstacle that we face is getting the insurance companies to buy in because, actually, in all fairness and honesty, it's much cheaper to prescribe opioids than it is to do an integrated pain program.
Non-opioid pain relief can be anything from physical therapy to ibuprofen. The WVU Medicine Pain Clinic says offering more pain relief options is something they've been working on for a while.
Our particular program has multiple specialties in it that we use together to treat pain, all as a response to the opioid crisis. So we have exercise physiologists and chiropractors and nutritionists and counselors and massage therapists, dietitian, as well as the standard pain physicians who manage medications and do interventions.
Besides financial, there are many reasons why non-opioid options might be overlooked when a patient has chronic pain. Sometimes a patient is unaware of these options in order to request them or seek them out.
I think once people become aware that this is the trend and start to request this type of care, then the payers will have to come along. And when that occurs, then it'll be the norm.
The No Pain Act does not limit prescription opioids, but supporters hope that by incentivizing non-opioid options, less opioids would be prescribed overall. According to a study from 2019, more than a third of people who misused pain relievers in 2018 got a prescription from a healthcare provider. But the danger of prescription opioids extends past the people who are prescribed the medication. In the same study, about half the people who misused pain relievers received the prescribed meds from a family member or friend.
Congress over the last several years has spent hundreds of billions of dollars on the opioid epidemic. For many of those dollars, it has been earmarked for things like naloxone availability, support for first responders, things that you can do, training of the mental health workforce, and things that are all helpful for individuals who may already suffer from a substance use disorder. What Voices and our members and the No Pain Act really focuses on is it focuses upstream on those opportunities to prevent addiction before it starts.
West Virginia Representatives David McKinley, Shelley Moore Capito, and Joe Manchin were involved in introducing No Pain Act bills in the House and Senate. McKinley says that this is just one in a series of bills he plans to introduce this year that address the opioid crisis.
It's a cancer that has not gone away. And what happened over the last few years is, particularly the last year and a half, is we were distracted. Understandably distracted with the pandemic of COVID, but at the same time, people were dying all across this country from substance abuse.
The No Pain Act is currently referred to the Energy and Commerce Committee in the House and the Finance Committee in the Senate. For WBOY.com, I'm Shayla Klein in Clarksburg.